Hey there, it's the Period Doctor here to discuss another gynecology basic, how to take care of the vulva. A lot of folks have vulvas and vaginas, but sometimes we don't always know the difference and we don't know the best practices to keep ourselves clean down there. So I'm going to talk about all of that in today's video. As always, please like and comment and subscribe if you find these videos helpful. Let's hop right in. So first, in order to understand how to take care of the vulva and the vagina, it's important to understand your anatomy. So I always have my helpful vulva puppet in order to kind of teach things like anatomy. It's important to identify the parts, okay? So the larger lips on the outside are the labia majora. They actually are the hair-bearing areas, and so for folks who have gone through puberty already, there's going to be hair on this area, and that's going to be on both sides. And this is actually kind of the larger of the labial lips, and it actually serves to kind of offer protection for these inside. Just inside of that, we have the labia minora. The labia minora are going to be the smaller lips. They actually kind of start just under the clitoris and then go all the way down until they end just under the vagina. So if you spread the labia minora, at the top, we're going to have the urethra, and that's where we pee from. And so the urethra is actually connected to the bladder. That's why you can wear a tampon and pee at the same time. Because below that is the vagina. The vagina is obviously where periods are going to exit, where you would insert a tampon, things like that. At the very top, we have the clitoris. And so the clitoris is an important gland that's full of a ton of nerves, and that can be a source of pleasure. And if something were to get kind of lodged under the clitoral hood or there's an injury, it could be a source of pain. But ultimately, if you were to pull back the clitoral hood, which is kind of this little skin here, it's not always this prominent, obviously it's not made of silk, but if you were to pull it back, sometimes you can get a better look at the clitoris there, okay? And so these are the parts. We have the labia majora, the labia minora, we have the clitoris at the top, and if we spread our labia minora, we can see the urethra. There's a little bridge of tissue just below the urethra that separates the urethra from the vagina, with the vagina being on the inside. And so a really critically important point is that the vagina is actually what's on the inside. When you look at your bottom, you really can't see the vagina unless you spread open the labia. But otherwise, this entire portion outside that you can see without spreading the labia, that's the vulva. It is not the vagina. And the reason that matters is because the vagina is actually self-cleaning. So what does that mean? That means that you don't need to put soap on the inside of the vagina. You don't need to clean it out or rinse it out or douche or kind of insert any type of chemical to clean the vagina out. And the reason that's the case is because there's bacteria in the vagina that keeps the vagina perfectly balanced. And obviously that balance can kind of falter or change depending on what happens to your body and what medications you take and what you're exposed to. But the majority of the time, the bacteria that lives in the vagina is going to actually maintain a pH more acidic than not. And so that is the normal environment of the vagina, to be acidic. For that reason, when we have discharge that comes out, that acidic kind of discharge can actually bleach kind of darker underwear or underwear that has a color. You can see it bleaching that. That's normal. Also, discharge is very normal. The presence of discharge is super normal for folks who have gone through puberty, for folks who have breast development, underarm hair development, who have periods. It's normal to have discharge, and that discharge can kind of change throughout the month depending on what your hormones are doing. Normal discharge is typically a kind of clearish, whitish color, and it's not associated with like burning or itching or discomfort. Some people don't find themselves comfortable with discharge because they think it's abnormal, but it's totally normal. And so my job is to try to remind you that certain things are normal. But anyway, now about cleaning on the outside. So when we talk about cleaning on the outside, I mean, honestly, you really can just use warm water and clean hands to really clean the vulva really well. But a lot of folks do like to use, you know, some type of soap or something of that nature. If you must use soap, we typically recommend that you use like a sensitive soap, a kind of fragrance-free soap, a soap that doesn't have a ton of dyes and other unnecessary ingredients. So what you can do is apply that soap in warm water onto a cloth or so and just let it kind of run over this area. You don't need to insert anything inside or be super aggressive because the skin is actually super sensitive. In between the labia, the intralabial space, so if you spread the labia minora and the labia majora, there's a little area here where things can get trapped. Typically it's like dead skin cells and oils, and it kind of creates a little bit of residue that you can remove just with the tip of your finger. You can just kind of wipe down here and remove it on both sides, and that's super helpful to kind of avoid unnecessary irritation and too much buildup there. You can also do the same thing just under the clitoral hood, kind of wiping under here to make sure that there isn't anything trapped there, any residue, because it stays trapped, it can cause irritation. But otherwise, the cleaning of the vulva is actually very straightforward. You don't need to do too much. Less is really more. We don't need special soaps. pH balancing soaps don't do anything because the pH kind of factors are actually within the vagina, and that's not where we're putting the soap. So it's not super important to have a pH balanced soap on the outside. You don't need to smell like flowers or roses or pineapples or a fruit tray or anything like that. That's not even normal. The basic care is just keeping things clean and dry with warm water and sensitive soap. Now, when we're talking about wiping and other things like that, we almost always say we want to wipe from front to back because you're really wiping from cleaner to dirtier. And that's really the best way to take care of the vulva. Stay tuned for other videos to kind of talk about vulva care. I'll talk about how to insert menstrual products and wonderful things like that. Like, comment, and subscribe. Thank you so much for watching.